Postpartum blood loss can last for 2 to 6 weeks and sometimes even longer. What do you know about postpartum blood loss or bleeding? Let's find out in this video. Welcome to my YouTube channel Midwives for All. We are here to support you through pregnancy, labor, and motherhood. So do well to stay with us by subscribing to my YouTube channel, and please click on the notification bell so that you will be notified whenever I drop a video. I don't want you to miss any of my videos. After childbirth, it is normal to experience bleeding from your VG. This is known as postpartum bleeding. It's also known as lochia. And this results from the shedding of mucus, tissue, and blood as your womb replaces itself and returns to its regular size. So here are the things you need to know about this postpartum bleeding. Number one, the duration and amount of bleeding varies, but it lasts from 2 to 6 weeks. Number two, from start, the bleeding can be quite heavy, but it gradually decreases over the first few days after birth. So you have to pay attention. From start, it has to be heavy, but every day it has to be reducing. So pay attention. At any time it continues to be heavy after a few days, then something is wrong. Number three, the color of the blood should change from bright red to brown over this period of 2 to 6 weeks. So at any point, maybe after some days or weeks, the discharge goes back to bright red, then something is also wrong, because it's supposed to change from bright red to brown over the period of 2 to 6 weeks before it finally stops. Number four, after C-section birth, you will still have some bleeding. For some people that deliver through C-section, you will still have to have some bleeding, but in C-section birth, the bleeding will be lighter, and you find out that the bleeding stops earlier than those that give birth through VG. So number five, if you experience very heavy bleeding or passing of large clots, please act quickly and report such to your doctor. Don't listen to your neighbor or friend or relative that will tell you it's normal. Whatever that is normal, let your doctor be the one to say this is normal or not. So long you don't know what is normal and what is abnormal, please, you've known it today that if after some days or weeks and you go back to very bright red colored bleeding, you need to report that, or you start passing a very large clots of blood, report such to your doctor. Then number six, if you breastfeed your child, if you are breastfeeding, you probably notice your womb contracting and more blood loss during the feed time. This is totally normal. During breastfeeding, your body is releasing a hormone that continue to cause the contraction of the womb, and this contraction will also help the shading of the uterine lining and also helping the uterus to return to its regular size. And this contraction will also bring pain, which is called after pain. So this is normal. There's no cause for alarm, but at any point you are feeling the pain so intense or you are getting worried, also report such to your doctor. So the next point you need to know is that while some women won't encounter severe bleeding, some may face a very serious condition known as postpartum hemorrhage. So postpartum hemorrhage occurs when you lose 500 mils, that is a pint of blood or more, within the first 24 hours after delivery. We also have a primary postpartum hemorrhage and secondary. Primary occurs immediately after birth, then secondary occurs between 24 hours and 12 weeks after delivery. So this primary postpartum hemorrhage can be minor when it is 500 to 1000 mils of blood, and then it can be major when it is 1000 mils and or even more. Because you don't know when you are losing 500 mils of blood or 1000 mils of blood, so anytime you feel that your pad is soaking too much, or you change pad every hour, your pad is already so soaked up and you are worried and you are concerned, just report to your doctor so they can evaluate and see if you are passing more than required. Okay, so how soon after birth did you notice your bleeding stopped? Can you remember? put that in the comment section. So thank you for watching this video, and keep inviting your friends to this page, and don't forget to like our video and drop a comment for us. Bye.